February 2025. It's such an amazing Wednesday to be here, and just being here, it means that we have a reason to thank the Lord. I hope that you're well. I'm so glad to be with you on this show, and I'm hoping that you're happy to be alive. Yeah, as unaweza kuwa maybe kuna issues hapa na pale, but just being alive is a whole blessing. All right, karibu sana. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God, and of course the show on air is Afya Clinic, where we talk about everything health. Okay, and last week we had an amazing conversation right here where we talked about cysts. Now kakwana a lot of questions. I hope that you got help while you needed, and we say that there's always hope. Sawa sawa. Most of the people walikuwa wanasema unajua niliambiwa cyst ni cancerous, but doc akatuambia no, it's not always that cyst yuko cancerous, and that was good news, as we said. So I hope that the whole of that week you've been pondering on that, and if there's any one of us who needed help, I hope that you got the help that you needed. All right, so karibu sana. On today's show, it's yet another whole week that has passed from Wednesday, and today we'll be talking about autism. Yeah, so tukimaliza the show last week, we had said that if you have any question, if you have any topic you'd want us to talk about, please send them on our WhatsApp number, on our SMS code, on our online platforms, and you'll be able to get it. And we got your feedback, and now because of that, today we'll be talking about autism. This is a question that has been of concern to some of the people, as we saw from the questions. So if you have any question, please feel free. All right, now today you'll be hanging out with Mika Hugu, and I'm so glad that we have been able to do this. And today we'll be having a doctor who's not so new to all of us. We've had him here, like, should be twice. Atakuwa anatuambia should be twice ama mara tatu hivi, and every time he's been here, we've been able to tackle these conversations. We've been able to talk about hearing loss. We've talked about autism. We've talked about there's a time we talked about teaching kids how to speak. Should be it, right? Yes, that word you've said. Atatuambia tukionde, yeah. So that has been it. So let me once again welcome you to Afya Clinic on MBCI TV, where we'll be talking about health. So please feel free. Our numbers are very open. That is 0721 105 105 on WhatsApp, and of course our SMS code, which is absolutely free, which is 23814. We are live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. On all those social media platforms, we'll be able to get your feedback. But of course, ukitafuta everywhere else on all social media platforms, and pale you search for Rachel Kahugu, you'll get me. Send in your message, send in your comment, tell us how you are doing, how your week has been, what are you thanking God for. We'd love to hear that from you as well. Tutaweza kuipata through those social media pages. Now, as we get into this discussion, I want us to first hear and understand what is autism. Maybe you're hearing it from the very first time. Maybe you're wondering, autism ni nini? For some reason, there are people who've seen people with autism, or have seen people who have the symptoms of autism, but didn't know what autism is. Now, that is why we're here, because we need you to understand that, and we need you to know is that treatable? How can you live with someone who has autism? So that is all what we'll be talking about today. But let's get into the in history segment, so that you'll get to understand the ile ugonjwa ambayo inaitwa autism, and just know what that exactly is.
Autism can be traced back in the early 20th century, though the understanding of the condition has evolved significantly over time. The term autism was first coined by Swiss psychiatrist Eugene Beller in 1911, initially used to describe symptoms of schizophrenia characterized by social withdrawal and a focus of inner thoughts. However, it wasn't until 1943 that the modern understanding of autism began to take shape, when American psychiatrist Leo Kanner published a recognition on his seminal paper on early infantile autism. Kanner described a group of children with distinct social difficulties, repetitive behaviors, and communication challenges, marking the first of autism as a unique development disorder. In the 1960s and 1970s, autism was widely regarded as a rare condition, with many psychologists attributing its causes to poor parenting, particularly the notion of refrigerator mothers, a term popularized by psychiatrist Bruno Bettelheim. This idea was eventually debunked, but it held sway for several decades, further stigmatizing families of children with autism. During the 1980s, research began to focus more on neurological and genetic aspects of autism, and the first edition of the Diagnostic and Statistical Manual of Mental Disorders (DSM) included autism as a distinctive disorder, officially recognizing it within the broader category of childhood psychosis. By the early 20th and early 21st centuries, scientific understanding of autism expanded significantly with advances in neurobiology, genetics, and diagnostic practices. The rise of advocacy groups and increased public awareness helped shift the conversation away from misconception about autism causes towards recognizing it as a spectrum disorder with varying degrees of severity and manifestation. Today, autism is understood to have complex genetics and environmental factors, with ongoing research into early intervention methods, the neurodiversity movement, and the promotion of acceptance and inclusion for individuals on the autism spectrum.
Yes, so that is what autism is, and you've been able to understand the history of autism. Now, we've said the doctor that you're having today, he is not very new here. His family, Afya clinic, rather Rausha, Zote. Okay, and I want you to understand who Dr. Daniel is. So let's get into the guest profile so that as we will be coming back, we'll be diving right into the discussion. So let's get the guest profile.
Joining us is Dr. Kayaki Daniel Masafo, a renowned child psychologist with a PhD in abnormal psychology and a master's degree in speech and language pathology. He is the founder of Danville's Consulting, an organization committed to addressing speech disorders in individuals of all ages. Dr. Masafo is also the director of Adaville's Friends School and a member of the Listen to Me Mentee program at the Baker Institute for Children with Hearing Loss in Kenya, where he actively works to improve the lives of children with hearing impairments. Currently undergoing specialized training with the Middle and the Global Foundation, he continues to expand his expertise in special needs and speech therapy. With a deep passion for speech and language development, Dr. Masafo is committed to offering comprehensive and holistic solutions to speech and physiological challenges and psychological challenges. His wealth of experience makes him an invaluable resource in the field of child psychology and special needs care. Let's dive into today's discussion with Dr. Daniel Masafo, and let's explore together the world of speech and language therapy.
Perfect. So that is who we are having today. So stay tuned. Our numbers are very open, as I told you before. That is 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free. We are live on Facebook on MBCI TV Facebook page. We are live on YouTube on MBCI TV official YouTube page. So on the comment section, you'll be able to find your comments and your feedback. But of course, on all social media pages, you can search for Rachel Kahugu, and I'll be able to get your feedback loud and clear. Karibu sana, Doc. We are really glad to have you after Japita 1 year. Ijafika 1 year, but close to an year. Close to an year. How have you been?
I'm good. Endelea vizuri, nashukuru Mungu.
Amazing.
Yes.
Tell us a little bit about the school, even before you say hi to the people, because that has really caught my attention.
We started the school, I think, last year, and last year, I think in August, we started a school, and our main aim of starting that school was to do the integration of the special needs and also the inclusion program. For the kids that we see, but currently we are seeing the normal kids, but we have I think we have a population of around almost 100 for the whole school.
Okay.
But our main aim is to do the inclusion program for the school.
Okay.
So that we include the autistic kids, the visual, the hear, like for the ones that have the hearing impairment, because that is the main aim of starting our school.
Yeah.
but currently we haven't received any. So, and we are also outside the outskirts of Nakuru, so it becomes very difficult for our parents, for the parents of, for maybe our clients to reach us actually, but we are having an we are intending to open the school that is around Nakuru town.
Okay.
Yeah. So, but currently we are at Nakuru Teachers College, just behind Nakuru Teachers College.
Yeah.
Yeah, in Salga. So that is where the school is.
Okay.
Yeah.
Okay. Amazing. So karibu sana.
Asante sana.
We're really glad to be having you on this sitting to talk about autism. Na najua, but from the introduction, people already have questions about hearing loss and all that. But we're going to be having another sitting to talk about that. For now, we'll be talking about autism.
Okay.
So maybe as we start, in layman's language,
yes.
Autism ni nini?
Autism ni condition ambayo ina affect kukua kwa neurological developmental condition.
Okay.
Ina affect kukua kwa mtu nitasemaje kwa Kiswahili, behavior, interaction, ama activities zenye mtu anafanya za kila siku.
Okay.
So tukisema behavior, tunamaanisha kile kitu ambacho mtu, unajua mtu wa kawaida ana socialize na wengine vizuri, anazungumza, anacheza, anacheza na wenzake, anachokozana, anachokozwa, analia, anacheka. Lakini sasa tukikuja kwa watoto ambao wako autistic, wao wamekuwa reserved kwa vitu vyao wenyewe. Utapata ya kwamba mtoto ambaye ako autistic anacheza peke yake, anazungumza peke yake, anakimbia peke yake. Maybe social interaction na behavior zao haziko kama za mtoto wa kawaida.
Okay. So
utapata ya kwamba watoto ambao wako autistic, ama mtu ambaye yuko autistic, kwa sababu tuko na watu ambao pia ni wazima na wako autistic.
Yep.
Nakumbuka tukiwa shule, tukiwa enzi zile za 1990s kukuja mpaka 2003 pale, tulikuwa na watu ambao tulikuwa tunasoma na wao shuleni. Huyu jamaa angechokoza watu lakini hazungumzi. Anachokoza watu na yeye ama atasema neno moja na ananyamaza kabisa. Unajua ile wakati ni kwa sababu ya wakati huo ilikuwa inaeleweka ya kwamba this one is an introvert. Umeona, watu hawakuwa wanaelewa ya kwamba autism started way back in 1960s kule nyuma. But now imekuja tu kujitokeza hapa katikati between 2000 and 2013 pale. Ndio watu wameweza kuelewa ya kwamba now autism is there. Now they learned about autism. But autism imekuwa kutoka huku nyuma. So zile behaviors ambazo zimekuwa ya kwamba mtu haelewi kile kitu ambacho anafanya, maybe anachokoza wenzake, na wakati mwalimu haelewi ya kwamba huyu mtu ako autistic kwa sababu ya behaviors zake. So saizi ndio tunaweza kuona ya kwamba watu ambao wako autistic, or the people who are autistic, now the characters are now out. Now people can say this child is autistic by the way the child is behaving, by the way the child is interacting, and also the way the child is doing the activities. Yeah.
Now, you've said something that is very intriguing and very important, that kitambo watu wangesema, huyu ni introvert too.
Yes.
And you know, nowadays we also have people like that. Kuna watu tu wenye unajanga, huyu, she's just introverted. Hapendi kuongea na watu, hapendi kufanya all that. How would you know the difference between someone who is introverted and someone who is autistic?
Now, the person who is an introvert, this person will, they are almost the same characteristics of autism actually. And now we have the level 1 of autism. Level 1 of autism has the same characteristics of an introvert. They're almost the same. That is now what we call the personality traits. Now, when you come to this person of now, let me talk about the person with autism. and then I talk about the person of an introverted person.
Yeah.
Now you realize the person with autism, this person has a behavioral issue. Maybe this person will like do something like spinning. This person will the behavior will always be different.
Okay.
They will always be spinning, steaming, doing such a like things, and now somebody will even the interactions of this person and even the speech of this person will not be that clear.
Yeah.
You will see that maybe this person is like humming sometimes and a hum. Now you realize that this person is very calm but humming, singing inside. Or maybe there is a cartoon that this person, let's say Baba Black Sheep.
Yeah.
You see this person, you see, it's like singing from inside.
Yeah.
Now an introverted person, contrary to an introverted person, this person will just be cool, calm, behave normally, no harming, no doing any other thing.
Okay.
So you will find that this person is also actively participating in the activities that other people are doing. But an autistic person will not actively participate. This person atajitenga, atafanya vitu zake, atafanya, and this person, the good thing with an autistic person that is level 1, they are very sharp. They are very sharp. They are very intelligent. They are very intelligent. Yeah.
So what is the downside then, apart from we're talking about symptoms clearly. So what would be the downside, because you're talking about level 1 autism. Now umesema on level 1 autism it would be that this person is more closed off, right? Ako tu peke yake. Umesema mostly hata ana harm tu, fanya mambo yake and hainteract na watu wengine. Apart from that, what would be the downside? Because you say they're very sharp.
Now the downside of these people, most of them they will not interfere, like whatever. Maybe they don't even follow instructions because they tend to think that whatever they are doing is very right.
Yeah.
So that is something that people will not understand, that this person, because they want to do things on their own without being interfered and without being like you see, if you take a pen, this person maybe is writing and maybe you jokingly snatch a pen from that person.
Yeah.
That person will be very violent. Very violent. In fact, it can lead to a very big issue.
Oh, really?
So you just have to leave them the way they are.
Okay.
Like they want things to be done their way
in a
and not
way.
your way.
Okay.
Yeah, they want your way. And that is why you find a level 1 child, for example, there is a phone there because they're always in I think what they always interact with is the phone, either the phone or the television or a gadget.
Okay.
That
not
is
people.
Not people.
Okay.
So you'll find that once you switch on the program that this child is watching, they will be very violent and they will even start fighting. So, but when you come now to this other level, it's a bit tricky because for them, they will just cry the whole time. But for level 1, they will always try to defend their space. Okay. That is, yeah.
Okay, I see. So there's level 1 autism and then level 2?
Level 2.
Is little?
And then there is level 3.
Okay, yes. Now let's talk about level 2. What does that look like?
Level 2, which is also level 2 autism. Now this one it has now gone, it's called moderate to severe. Okay. Now you will find that this child now has, the speech is not there. Most of them don't have speech. And most of them have, they always have patterns of behavior. Maybe this person is, they are not completely not interacting with people, unlike the level 1, whereby the child is at least interacting with people and also having the same, or they are behaving with other kids or doing activities. The level 1 child follows instructions. If you tell this child, as long as it's not something that this child loves, if you tell this child, can you bring for me the chair, they will go. Can you greet this person, they will greet. Can you do this, they will always follow instructions. But level 2 autism, most of them don't follow instructions.
Okay.
And most of them, just from the onset, they will always have no speech. Yeah, they don't have speech
At all?
From the onset. Yes,
Okay.
from the onset.
Okay.
They will say mama, baba. The first two words, the first introductory words of a child, baba, ba, mama, ma, ta, ta, ta. They will have them. Then after a certain, that is why you hear somebody saying, mtoto wangu alikuwa ananiita mama, mtoto wangu alikuwa ananiita baba, and all of a sudden the child is not calling me anymore. Mtoto alikuwa anasema nipe kalamu ama nipe kitu fulani, pe tamu or something, and then all of a sudden this child is not saying anything. So that is where level 2 autism starts. The behaviors now becomes to be different, and then level 2 child will jump from one thing to another. They will always be jumpy. Yeah, they will always be jumpy.
Okay.
So you will find that this child is not focused on anything.
Okay.
Yeah.
Okay, I see. And now, unajua kusema they're usually jumpy, now people can relate, because most of the people think with jumpy kids, ako tu na sugar rush atakuwa sawa. And then they too, anakuanga too happy, because I've had that conversation, and the mom was saying that my kid anakuanga extremely jumpy. It's like they're sick, but anakuanga extremely jumpy, you know, and it's like a struggle between trying to compare what is what and trying to find out what would be the issue. But I'm praying and hoping that we'd be able to, you know, find solutions. And I know we'll be talking about, is that treatable and how one can go about that. But you've said we have level 3 as well.
Yeah, we have now, when now we come to level 3, autism. It is now, that is now where people don't differentiate between a mental case and the level 3 case.
Okay.
And that is where now most parents don't even understand. And that is why even most parents fight the medics, because they don't, when a medic tells this parent that your child has a mental issue, they will always transfer that one to an autism. You see?
Okay.
Now, because now level 3 is very tricky if you don't get if you don't like get a professional now it comes now a professional, or now that one is supposed to be a professional case, whereby now you are supposed to take this child to a developmental pediatrician, whereby this person will now determine, or a neurologist, where this person will now, the doctor will now specify the level at which this child is. Okay. And when you go to a doctor, they will give you the best results, whereby now this one is now in another level, whereby it is on an extreme, because an autistic child, now this child can do anything, can eat anything that is there, can maybe the focus is not there, and most of the time they also don't have communication skills like speech or anything. And at some point this child, the autism level 3, they are not, they will not like anything that is there. They don't fight. They don't fight. Those they are always cool, and once you do anything for those kids, they will always like cry, just trying to defend themselves. Because once you and they are also what can I say? Ni waoga.
What causes that?
Because they don't want like to confront and fight with you. They just want to let you do whatever you want to do. But they will always resist anything that you do. You tell them. And the level 3 autistic kids, they always feel very frustrated when it comes to speech. Anything to do with speech, they are always very frustrated. Yeah. So you realize that even if you try to maybe to help this child to communicate or anything, they will always want to, like they are resisting you completely from helping them to communicate. So it becomes very hard even for a speech or language pathologist or speech therapist to handle them. So it becomes very hard.
Is it because they've tried to to speak and they can't, and now that causes the frustration? Yeah,
sure. Because now even you are trying maybe to do something and then you are not doing it, then it becomes a frustration to you. So that is why now maybe we will talk about it now. where do I start? Where do we start? Where do we start helping this child when it comes to that level 3?
Okay.
Yeah.
Now let's talk about the causes of autism in general, not for level 1 or 2 or 3, in general, and then you'll tell us if it's any different. Ina move from one level to another. But for a start, let's talk about what is the cause of autism.
There are around 2 or 3 causes of autism. One that has been approved is genetic.
Okay.
Genetic, whereby maybe the mother or the father, they come from there is that lineage of autism.
Yeah.
Now you find that child will also be, they will always have that it is a genetic thing. And then we also have environmental factor, and also we have the lifestyle. So when you talk the environmental factor, now this one comes when the child is being born, maybe there is delayed birth, or the prolonged labor. Maybe there was an injury when the child was still young. Maybe there was an infection when the child was being born. So you realize that those are called environmental factors. They can affect the child. They can affect the child, and then you find that child will now be autistic. When you come to genetic, I've talked about it, and another thing is about now when the child the acquired one is very common. The very common one. This one now comes into the gadgets.
Okay.
Because now a child has been given a gadget. A child has been those one are they acquired.
Okay.
A child develops because a child
develop the autism.
Yeah, it is.
Okay.
It is now that one can just go. That one can.
Right.
It's easy to be treated. But now the problem with the parents of nowadays, they don't even have time for their kids.
Yeah.
Because when a child is born, a child is supposed to be spoken. Wakati unaosha mtoto mwambie ninakuosha, ongea na mtoto. You know, this child is getting the bonding. But nowadays a child is given to a house help. Huyo house help wakati mama anatoka, baba anatoka, wanapea mtoto simu. So that yeye afanye shughuli zake, afue, afanye nini. When the mother comes in the evening, maybe they don't even have time for the child. So it becomes now the child is for the babysitter or the house girl. So this child don't even know how to speak, don't even know how to do anything, because now everything has been left for the house girl. You don't know even what this house girl is doing for the kid. You don't even know whatever that is happening in the house. So the acquired one, you can prevent it as much as you can. Talk to your child, speak to your child, communicate to your child. When you enter the house, that is the time you need to bond with your child and communicate with your child. But if you are not communicating with your child, then it means that now the child will not even have people to communicate with. The only communication that the child will have is either, and most of these parents, what they do, akishafika kwa nyumba, because hataki mtoto karibu yake, I don't know how some parents really behave, because you are in the house, you don't want to play with your child, you don't want to talk to your child. The only thing you can do is to switch on a television, and then you leave the child there. Unaweka mtoto kwa inaitwa nini? The one that kids are put on, and then the strollers.
The strollers.
Unaweka mtoto kwa stroller, and then unamwachia TV, then we unabaki kwa simu. You know, you are also addicted to that phone, that you don't have even time for your kid. So it becomes a problem. Now, and then when you come to our clinic, we tell you this child, wewe ndio umemwaribu. Now you are saying, okay.
It becomes a problem.
It becomes a problem now with you also. Because you have told them the truth. Yes.
Now the acquired one, is it level 1?
No, that one now.
Ama ni general.
Hiyo ni general. That one is general.
I see. Now, I know we have questions coming in. about autism, and we'll be getting to take a look at that. But before we do that, maybe let's get into the vox pops so that we'll hear what people think about autism. I know there's a lot of stigma that surrounds that, and we'll be looking at the myths and the misconceptions that surround autism, just to see what we can rectify and what we can't. All right, but for now, let's get the vox pop so that we'll get to understand what do people think about autism. What do people know about the autism?
It's caused by maumbile, inheritance ama uchawi.
Autism ni ile tu ugonjwa ile maumbile kenye maybe kiangalia hivi mtoto unamuona ni kama yuko sawa.
Maybe uchawi ama ugonjwa.
It's caused by maumbile, inheritance ama uchawi.
Autism ni ile tu ugonjwa ile maumbile kenye maybe kiangalia hivi mtoto unamuona ni kama yuko sawa.
So that is it about autism, and it's funny that most of the people think or feel like autism ni uchawi. Now let's start with, just explain for someone who has autism,
Yes.
what is happening in their body. Is it a mental issue? Like, what exactly is happening in their bodies for us to see these symptoms?
Autism, as I said, it's a neurodevelopmental condition. Autism has nothing to do with the physical part of a child.
Yeah.
It has nothing to do with the brain of a child. The brain is affected actually, but now it is wired differently from us. But this person is supposed to do things very normal. Very normal.
Yeah.
Because tukiangalia kwa enzi zetu, wale watoto ambao walikuwa wako na autism, sisi I come from Luyaland, whereby now walikuwa wanasema watoto ni there is a language they normally use, I don't know, but ni watoto walaana. That is what I got, what I get from the community.
So we've heard from
but now, I have heard from them. Now they're saying that autism ni uchawi. It has nothing to do with that.
Yeah.
There are some even say that maybe mama ama baba walikosea mahali ndio maana wakapata mtoto ambaye ako autistic.
But no.
It is something that just comes, and even some parents even don't know where to start and what to do. Ni kitu tu imejitokea, and this is a condition that can be managed very well, because we have autistic kids or autistic people that are engineers. We have autistic people that are doctors. We have autistic people that do very great jobs in this world.
Yeah.
So you can't say that the neurodevelopmental condition can hinder this child from doing any other thing.
Okay.
It is now in the mentality of the parents that kwamba mtoto wangu ako special.
Yeah.
Now, if you take me, for example, if my mother takes me to be a special child, I will just be a special child. I will, definitely.
You won't be normal.
I will just be a special child and I will not be normal.
Yeah.
Mimi, nakumbuka now, I want to talk from my own perspective, or from my own experience back at my home. Now, you see that if my mom always calls me Baba, Baba, you know, I just know that I'm a Baba in the house. And even I'll do things as a Baba in the house, like a Baba in the house, isn't it? I'll just do some funny things in the house, because I know after the end of the day, my mother has taken me very important than any other child. So you find that this child is supposed to be taken very normal, like any other child.
So that
don't treat them special.
Does that mean that they also go to the normal school?
The normal schools.
Okay.
They're just supposed to be in a normal school, because an autistic child can read, understand, and comprehend things.
Okay.
The only thing that is happening, it's a neuro thing that is happening in their bodies.
Okay.
They can just do any other thing normal.
Okay.
And if this child can now be taken care of early, that is now where the early intervention comes in.
Yeah.
This child will be very normal, do things normally. Chenye tu maybe kitamsumbua kidogo, the only thing that disturbs watoto ambao wako autistic na inawa frustrate ni speech.
Okay.
That is the only thing.
Okay.
But if this child can be given a focus on speech, aweze kusaidiwa, alafu aweze kuzungumza, Now the child is very normal. Anafanya vitu zake peke yake. Hata zungumza kama mimi vile nazungumza, lakini akiweza kujiexpress, aseme ya kwamba ninataka mami ninataka kitu fulani, mama ninataka dadi ninataka hii. You know, it becomes a holistic growth of that child. But now the frustration comes in whereby this child is not expressing him or herself. So that is where the frustration comes in.
Okay. And I love that you've explained that they're very normal kids. So they'll go to normal schools, they'll do everything normally. But then that means that you're talking about autistic kids. As an autistic kid, does it go away with time? I mean, now we have people who are teens, youths, men and women who are still autistic.
There is a time I talked about, I think it was here, I talked about behavior and something that somebody was born with. For example, I talked about these extroverts. And I said an extrovert will just have behaviors ambazo huwezi zitoa na huwezi ziacha. You know, this extrovert, you know, they are also wanabehavungu, their behaviors pia zinakuanga kama za autistic kids. Unajua, an extrovert will just say anything, do anything, and then they don't feel offended. You see, they just very normal. Hata atakwambia Rachel, wewe, you are very stupid. And you know, they will not feel like they have said anything
but they have.
bad. But they have. You feel, huyu jamaa amenikasirisha, kwani ameniongelesha aje. But you know, they're just laughing, doing their things. So it's just the same way with an autistic child. This thing will not go away. It is, this person will live with it forever. Akunanga ati itafika mahali. There are some people who say, okay, autism will go with the time, maybe mtoto atafika mkubwa iishe. No, the only thing that you can do about it is to manage. You manage it. You just live with it, manage, do the necessary that you have been given, or the things that you have been given by your doctor, and then you follow them. Because these autistic kids, the only thing they want is routine. Kama huyu mtoto amezoea meza hapa, kutoa hii meza hapa uweke pale, hiyo ni shida. Hiyo ni shida, tena ni shida kubwa sana. Umtoe leo maybe gari yenye umezoea kutumia ni blue, kesho utumie ya green. That is a problem. They always follow the routine and they stick into it.
So you can't change their schedule.
You don't.
It has to be a certain way.
A certain way. You don't change their schedule.
I see.
If you're taking breakfast at 8, by 8 that child will be on the table waiting for breakfast. If you take at lunch, even if the clock is not there, they will always do by whatever. They will always follow the schedule. They will always follow that.
I hear you. Now, what is the... Should we start with treatment or management? Is there a treatment for autism?
Up to now, there's no treatment for autism.
So it's management?
It is management.
Okay. So what's the management for autistic people?
Now, the management for the autistic people, one, we have the behavior therapy. The behavior, because behavior is beyond control for most of them. And then now the speech part of it, whereby they don't have speech. Most of them, the autistic kids, most of them, or the autistic people, most of them, they don't have speech. Now we say speech for an autistic child or for an autistic person has also time limit for you to catch up with time. Ndio huyu mtoto aweze kuachieve speech yake with a certain time. So unapata ya kwamba an autistic child, if you start the early interventions, it's easier. That is from 2 years to 4 years. Those are early interventions of speech. Now you come now to above those years, maybe up to 15 years, or maybe up to 10 years to 12 years, 13 there. Now those are also another. But once the child is beyond there, now the child cannot be managed. Now it becomes a very hard task for you, even as a professional, to tackle or to handle that child. Now most of these parents, I think, because of the frustrations and also because of learning so much, I don't know, is it because of what can I say? Like now, because of so many things that they hear says, Now, most of them have become their own, they are professionals themselves. You give a parent, for example, a therapy plan for their child. They will always like, now they start and then they disappear completely. Now, most of them feel like, or meshika, or they know whatever that you're doing or anything, and then they go, they disappear. And then now you because obviously we have like our records, so we try to follow on to this child, and then you see the child that they at 4 ametoka, umeona mtoto like 1 month, 2 months, now and then they disappear. Now an autistic child, for you, they need to have like a therapy plan or an individualized education plan. I think Madam will talk about it. Now, an individualized education plan includes also the therapies that this child is doing. If the child is doing behavior, if this child is doing, for example, is seeing an occupational therapy, if this person is seeing a speech therapy, what are they doing, like a holistic thing? What are they doing? So, for example, me, if I see a child today, I always follow this child to the school where this child is learning. Niambie mwalimu ya kwamba, sikiza madam, ama mwalimu, huyu mtoto anafanya hii na hii na hii. Can you follow this? Because I'm only an instructor. I'm not like, mimi si mwalimu wake. I only see this child like 1 or 2 hours for the whole week. So you realize that the teacher will do a lot of work. The parent will do a lot of work. So I sit down with the parent, I sit down with the teacher, I give them a plan to follow. So that when I come for this 1 hour, that I'll see the child for a day or 2 hours, now I give them everything for them to do as a plan. So they become, me, I'm only an instructor, but for them, they are the real people who are doing the therapies.
So the
you realize that
the teacher.
So yeah, the mother becomes a teacher, and also the teacher knows exactly what the therapies are supposed to be done. So you will find that this child grows, the growth of speech and the growth of this child will be very fast, because we are all doing the thing as a team. And that is now where the rehabilitation team comes in. A parent is a person to do the rehab. A teacher is a person, me coming in as a professional to do the rehabilitation.
So that helps. And with time, you won't even know the person is autistic. They'll be able to live a very normal life. I think now, this is where we look at some of the myths that surround autism, because it's also a very heavy topic, especially when people are talking about, you know, autism, lazima ni makosa fulani ulifanya. Ama if you're autistic, this and that. But we've heard that it's ni ugonjwa kama zile zingine, and it is very well manageable. Sawa. So those stories are, hey, it came from here, it came from that. We've heard from the Vox Pop people saying that hata saa zingine they think ni uchawi. No, that is why we're here on Afya Clinic, because you need to understand everything health, autism included. All right, now let's take a look at some of the mythbusters, just to be able to understand what are some of the myths that surround autism. We should be having them. Okay, so the first one is that all people with autism have intellectual disabilities. Is that true?
No.
Okay, so all people with autism, not all. Do we have others who have intellectual disabilities?
Autistic people don't have intellectual disability.
At all? At all. Good to know.
They don't have.
Yeah. Okay. The second one is that individuals with autism can't live independent lives. Surely, you guys. They
live, those people with autism live a very normal life. Independent life. It's only that people have taken them special. The way I said, if you take somebody special, they become special. Yes. Okay. So they can, in fact, the autistic people, if you put them on a routine, they will follow that. And we, as the normal, the way we are living without any developmental condition, you know, I'm supposed to wake up in the morning, enter in the bathroom, brush my teeth, take my breakfast. Is something that you do. You see, so if you put them on that program, they will always follow. They don't have anything that affects them. There is nothing.
Okay. That one, which is the last, is that autism is caused by bad parenting. Oh, really? That's a very thin line.
That's a very thin line because it is something. I think I said about that. The parents of today, they're doing parenting badly. That one we can.
But what is badly here?
Badly is whereby.
What does badly mean?
Is whereby a child has done a mistake and you cannot correct your child. A child is on social media and you cannot take it from that child because you feel now my child is the only child, especially the firstborn. My age zetu hizi ba. Are we alpha or what? This generation of ours and my Gen Zs. So you find that we want to take our kids. For example, some of us maybe went through a very hard time growing up. Maybe hatuko tunatembea na viatu, hatuko tunaenda shule na mapancha, hizo mapancha za umechapa chapa nyuma, kuna green, blue, yellow everywhere. So you want your kid to be like a cool child. A cool child. The
exact opposite.
Yes, so there is that opposite. Unasema ya kwamba mimi nilipitia mashida, mtoto wangu haizipitia shida. Like now, the problem now we are also having, maybe a mother is very tough in the house, wants to put things in order. And now when a father says, hey, wachana na mtoto wangu, we bambana. Unajua, we are living in a lifestyle whereby if one parent is good, another parent is very tough to the child. So wanaanza kuvutana pale. Then mtoto anaanza kusema, nasi dadi hata ananipenda. Huyu mama tu ni wa kunisumbua. So you find that if you're speaking one language as a parent, as parents, speak one language to correct your child. Just correct your child. That one works. Because now the child will grow knowing, hii ni mbaya, hii ni mzuri. So I'm not supposed to do this because I know it's bad. Of which most of the parents nowadays, they don't tell their child. That is bad parenting. But now autism is a different thing. Hii ni condition tu inaambia mtu we enda chukua kitu fulani au ufanye nini. Now you see, because now that is where now the occupational therapy comes in interprofessional collaboration. Now when you see a child having such a behavior and you see the child also having the characteristics ambazo tumesema pale, that one needs an intervention from a professional. Tafuta a professional akusaidie ili, lakini sasa hiyo bad behavior ni mtoto tu ako normal, anaongea, anafanya nini, anafanya vitu zake. That is just bad behavior. So there is a thin line between bad behavior and autism. Yes.
I think now that you're talking about it, most of us, Najwa, we'd say that we might have seen that in one or two kids in our day-to-day activities. A kid that you meet and you just tell they're doing this because of how they've been raised, or they're doing this because they're so used to it's me and my gadget or my TV and just that. So that's a very thin line there, but Pendavulu may explain. So please, let's not allow our kids to have acquired, you've said it's called acquired? Yes, acquired autism. That's so wrong. Now, I know we're almost going for a very short break, and of course after the break we'll be coming back with a teacher as we talk about autism, but really from the outside perspective. So if you're living with someone who has autism, what are you supposed to do? And generally for the people who are supposed to be caregivers for the autistic kids or the autistic people, how are you supposed to take care of them? We've had, Doc, you've said that they live a very normal life, however in these special schools, they should integrate with other people, which is very important. But then we need to know, because it is true that actually there's a problem here. What are you supposed to do about it? Or how are you supposed to go about it? So we'll be talking about that. But before we take that break, I see we have like 3 minutes. Hopefully we'll be able to wind up on these. Maybe, what would you say would be your word on autism? I know there's so much to say around autism, but what really would you say, like a blanket answer to the people who have autism, or people who are living with people who have autism?
Now, the people who are living with autistic people in the homes or in the houses, one, you need to show them love, impress them, be like them, be in their shoes, and everything will be very normal. And then you do the interventions. Interventions are the only thing that can help the child, autistic person, to live a very normal life. Don't assume, because now you, if you understand what autism is, you do the things that are supposed to be done. Do the interventions, and the rest leave them to God. Because if they can just do the normal things, autistic kids live a very normal life if the interventions are done perfectly.
Okay, perfect. Now, for the people who now need help, need therapy, or they have people who have autism and they've realized that labda imefika level 2 or it's going to level 3 and they need help, wanaweza kupata wapi?
Now, just a point of correction. A child is born with level 1, level 2, and level 3. We don't have like it's now moving to level. No, it doesn't move to a level. It just if a child is level 1, ni level 1. Kama ni level 2, alizaliwa tu na level 2, na kama ni level 3, alako tu na level 3. We are at CK Patel. That is where our clinic is. At CK Patel. Ukikuja pale 3rd floor utatupata hapo. That's where we are. Perfect. Room? Ama wakuje tu CK Patel? CK Patel, just ukikuja pale ENT, there is a Nakuru ENT. You will find us there. Perfect. Thank you so much. We'll be getting a number if you have one that people can call. But I know that you're coming back after a very short while. For now, let's just get a very short break so that you can also see some of the adverts that you did, because that is very important, and also get to see other things that you do as MBCI TV, because we say that this is a family TV. Okay, so we're taking a very short break and then we'll be coming right back. We'll be giving you a number that you can call if you still have any question that you would want to ask. But for now, let's take a very short break.
Unleash your creativity. Welcome to Gilgil Hills Academy, a mixed day and boarding school, the one-stop school of educational opportunities for your child. We are strong together. We are located within Gilgil town in a serene and homely school environment. We offer the best competence-based curriculum at its best. A strong team of highly skilled teaching staff is on hand to provide, with great attention to detail, a stimulating, individualized learning experience for your child. Our rich programs and wide range of facilities allow your child's maximum exposure, participation, and convenience in learning. Come and be part of the greatness of the Gilgil Hills family by calling 0794 952 635 or 0710 308 818. Your child deserves the best. Gilgil Hills Academy, the real school with a difference.
MBCI Television, transforming lives.
All right, now we are back after that very short break, and as I had said before, is that we are talking about autism. So if you're just joining us, karibu sana. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God, and the show on air is Afya Clinic, where we talk about everything health. Okay, now today, I'll be your host, Rachel Kahogo, and our second guest will be joining us in a very short while as we talk about living with people who are autistic, or if you are a caretaker, you're supposed to, or a teacher, right? And just to understand what are some of the challenges that these people face when they are in schools, in the communities, what are the challenges that they face, and what exactly are we supposed to do about that. But before we go there, we'll be looking at healthy living, and we may be prepared by the one and only for Dr. Daniel, that is 0727 052953. Okay, and you can always call directly to the clinic, that is Nakuru ENT, that is 011 4600 796. Okay, 011 4600 796. I know the numbers will be running on your screens. so that you'll be able to call when you need to. For now, let's get healthy living so that we get to understand how to live healthy. Prepared by the one and only Sylvia Wanja Sinembali.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today we are going to discuss about the myths and misconceptions about autism. Autism spectrum disorder, that is ASD, is often misunderstood, leading to myths that create stigma and misinformation. Here are some of the common misconceptions and the truth behind them. Number 1 myth: autism is caused by vaccines. There is no scientific evidence linking vaccines to autism. Multiple studies, including those done by CDC and WHO, confirm that vaccines do not cause autism. The false claim originated from the discredited study in the 1900s. Number 2 myth: people with autism lack emotions or empathy. Individuals with autism do feel emotions deeply but may express them differently. Some may struggle with social cues, but this does not mean they lack empathy or do not care about others. Myth number 3: autism only affects children. Autism is a lifelong condition. While symptoms may be more noticeable in childhood, autistic individuals continue to experience challenges and strengths throughout their lives. Autistic individuals continue to experience challenges and strengths throughout their lives. Number 4 myth: all autistic people have intellectual disabilities. Autism affects individuals differently. Some may have intellectual disabilities, while others may have average or above average intelligence. Many autistic individuals excel in specific areas like mathematics, music, or technology. Number 5 myth: autism can be cured. Autism is not a disease, therefore there is no cure. However, with early intervention, therapy, and support, autistic individuals can lead fulfilling and independent lives. Number 6 myth: people with autism cannot form relationships. Many autistic individuals form deep and meaningful relationships. They may communicate and socialize differently, but they can experience love, friendship, and connection. Myth number 7: autism is a mental illness. Autism is a neurodevelopment condition, not a mental illness. However, autistic individuals may experience mental health challenges like anxiety or depression due to social struggles or misunderstandings.
All right, we're back, and that is it on healthy living. Okay, so those are just some of the things that you need to do. Asante sana Sylvia Wanja, God bless you. Now we're back, we're talking about autism, and now we are having Morara Michelle, and she is a teacher, and she tutors. That's the right word? Yeah, she tutors kids with special needs, and that includes kids who have autism. And we'll be getting to understand, as a teacher or someone who's living with an autistic kid, what are some of the things that you're supposed to do. How are you?
I'm very well, thank you.
Karibu sana.
Asante.
We are very happy to be having this conversation.
I'm happy to be here.
Asante. Now, tumetoka kuongelea autism with Dr. Daniel, and I know that we've been able to understand what autism is and what causes autism, and any other question in your autism. By the way, our numbers are still very open. I'll just repeat the numbers. That is 0721 105 105. On WhatsApp 23814, our SMS code, which is absolutely free. We're live on Facebook on MBCI TV Facebook page, we're live on YouTube on MBCI TV official YouTube page. So ukienda pale, you'll be able to send in your comment na tutakuwa tunaipata, and of course on all social media pages as Rachel Kahugo. Now, Michelle, please say hi to the people. This is your camera, and then we'll be starting.
Hello and good morning, good people. I am happy to be here, and I'm ready to share what I know about autism so that we can all learn and be in the same space with everyone.
Amazing.
Thank you.
Now, let's even start from the very interesting part. We know people who are teachers, but people who are teachers who tutor kids with special needs, that's a calling for sure. How did you get there? Is it something you decided? Abulijipata?
So when I began my teaching profession, I always wanted to do something more. So I decided to take on special needs education because for me, I not only wanted to teach, but I wanted to do it in a different way. I wanted there to be something more about it.
Okay.
Yes.
So okay, it's very important that you've said you wanted there to be something more about it. So currently, what is that?
Okay, currently, what I mean by something more is special education generally is about meeting the learner's needs. And we have different learners. As we said, today we're talking about autistic learners.
Yeah.
So autism is a form of neurodivergence. And learners, the ones that we call normal, are they're typically developing. So typically developing learners, we have those. We have those with other neurodivergences.
Yeah.
And with those learners, you need to put in some intervention and extra work with them. So that is why it comes with them more.
Okay.
Yeah.
Okay. Now, today generally we'll be talking about the autistic kids, and I know where you teach, it's diverse, but let's narrow down to the autistic kids. So, what is it like tutoring or taking care rather of autistic kids?
Okay. So, autistic kids, as I said, will be found, and as the doctor also said, they'll be found in normal schools, or regular schools, as we would term them.
Yeah.
So in such schools, you would find that you have students that they're not the same as the other ones. And this would show with some characteristics. For example, they would have very repetitive behavior. They would have a lot of sensitivity to stimulus, and their sensory stimulus is so high. So whether it's the lighting, they would be triggered by a lot of light or a lot of noise that would also bother them. So you will notice that there is something different. They would also not understand some verbal cues, and you will have to be really direct. So obviously you will see that there's some difference with these kids, and that is how you get to identify an autistic kid from a normally developing kid.
Okay. And you said that for these kids, they react to different things. So is it usually the same for every autistic kid, or you'll now have to learn every kid and know what affects them, what's the stimulus? Do you have to learn for each and every kid?
Okay, so that's a good question. Autism is a spectrum, so it manifests different in different individuals.
Yeah.
So some of these characteristics will manifest strongly in others than in others, but there's characteristics that cut across. That is why those are the ones that I used to identify as students or children with autism.
Okay.
Yes.
So what is one of the main things that you need to do as a tutor for people or rather kids who have autism?
Okay, so as a tutor, as a teacher, you need to first identify. You identify the learner, and then after that, you can come up with some interventions. For example, when you are teaching in the classroom, you should make sure that there is not autistic children, as I said, they react really strongly to their sensory awareness is very strong. So whether it's the lighting, to them it's not like how a typically developing person would experience lighting. So they would experience it in a very strong way. Whether it's noise, they will experience it in a very, they hear everything at once. They cannot differentiate, so it's going to be overwhelming. So as an educator, you need to make sure that your classroom space accommodates that. So whether their sitting position should accommodate that, so you should cater for that. You should also have routines, as the doctor said. Autistic people, they thrive in routines. They always want things done a certain way. They want it to be predictable. So whatever you do, you have to make sure that it is predictable. There's a routine that is with that. So in your classroom, when you begin your lesson and how you go about it, there has to be things that keep going. And another thing that I would mention that is important is when you also have an autistic child in your classroom, an autistic student, make sure that whatever it is, the instructions that you're giving are also visual, because sometimes they get confused with verbal instruction, as the doctor had said also, that you might do something and they take it so strongly. It's because they don't understand something, so they have to see the instructions that you give. They have to see. You mean this, so also include visual cues. Yes, and lastly, you can also incorporate behavior rewarding systems. If they good behavior is rewarded, so they know this is what is supposed to be done.
Okay.
Yes.
Works well. Works really well. Now, in your profession, what are some of the misconceptions that you've encountered mostly around teaching kids who are autistic?
Okay. About teaching kids who are autistic, I have had people say that they are not normal. I've also had people say that they have some deficiency in their mental capacity, so they think they're intellectually disabled, which is not true. Yeah. Autistic kids might need help to achieve the objectives in their education, but that does not mean that they are ill-equipped or they are mentally handicapped. Yeah. Yes, so that is one of the myths that I have encountered. Another one is that they are very, you cannot control them. Yeah, which is also not true, because with intervention, like, as I was saying, routines and all that, they learn and they know how to behave, how to be in the school space. Yeah. And also that also carries back home and into the society, so it also helps them. And yeah, that is also a myth. Okay. Yeah.
So you say they follow a certain routine.
Yes.
Or a certain schedule. So what happens when you need to change something in their schedule?
Okay, so for that you will have to be, okay, there's those things that won't change. For example, their sitting position in the classroom. That one, it just has to be, because if you want to change that, it's going to be very difficult.
Oh, really?
Yes.
Okay.
They really like their space. If I sit here, I sit here. This is my chair, this is my desk. Yeah, usikuja. This is mine. Yeah. So you have to maintain. There has to be those that stick. Yeah. For the others, you can gradually introduce those changes, because, for instance, if it's a different lesson already, obviously that has to change. Yeah. So that is a bit of an easy transition. But those core things, that normal routines, everyday routines, those would be quite difficult, to change.
So when you need to change that which is difficult to change, how do you go about it? Is there a process to it that would make it simpler for them to adapt?
Yes, you will have to do it gradually. So you will have to make it now the new routine, but gradually you will have to start slowly and then move into it. Yes.
Okay. I see. We have questions coming in, but before we answer, maybe we'll just read two. But before we answer, how would the society, because now you've been able to lembiwa students wanakanga na walimu 70% of their lives, and then 30-ish, not even 30-ish at home and in the society, so you know them better. So what would you advise the society, or rather, how would the society be able to allow them live a very normal life?
Okay. So first is to accept the autistic people, because as the doctor said, they're not just children. They start as children, they grow up, and so it means that there's people in the society that are autistic. Yeah. Maybe they just try and hide it. And just accept them as they are. Have a positive attitude. That also is part of acceptance. So change your attitude about them, in that get to learn about autism and autistic people. Yeah. In the instance that you know that they experience the world differently from you. Just a bit, because there's this, the way they see the world is a bit different from the way you see the world. So you have to also accommodate and understand them from that perspective. So if an autistic person, an autistic child cannot understand sarcasm, you should not, or you say something and they take it so seriously, don't take it personally, because they just don't understand. Their brain cannot process that. So you need to be very accommodating.
Yeah, it's not their fault.
It is not their fault. It's just how they view things. Okay. And accepting them, not judging them. And another very crucial part, which I'm also thankful for this show for, is education. So educate yourself about people living with autism. The more you get to learn, there is a lot of resources out there. There is shows like this. There is people who actually make their own shows, autistic people who tell people how they want to be treated, how they want to. Yeah, there is. So you can go and look at that. And I should also say or back up what the doctor had said about they don't want to be treated special. They're just other people who just view the world differently. Yes. So when you accept them, change your attitude, get to learn about them and interact with them, even if it's online. Or you can also interact with people who are working with people who have autism, like the doctors, teachers, and that would help.
There's a lot of stigma that surrounds autism. How do you deal with that, and how do you help your students feel more comfortable? And that would help people who are living with people who are autistic, to help them feel more accepted and just remove the stigma, because there's so much stigma that surrounds autism. So what would you say about that?
Okay. So starting by me and how I would work with my students, So in a classroom environment, I would try and make it as inclusive as I can. So I would not treat that child in a very special way that they feel they're special, but you accommodate them, you tweak and change those things that would be very triggering for them. Yes, so you tweak those, you accommodate, you make sure that the classroom is a very safe space for them, it's an accommodating space. And you would also educate also, because the stereotypes and the stigma is because people don't know. So when you don't know something, you come up with your own assumptions, or if someone says something about it, then you believe it. But if you educate, so that's also part of it, campaigning and educating people about it. Yes.
Okay, that's very important. And especially for you say that, and I'm thinking about the society, because now in schools, it's more of you have to. Kwa the same class, you have to make them feel comfortable. But then in the society, it then happens that it's your own choice. So, as you said, then people get to just hear things about people who are autistic, and they believe it and move with it. And I'm saying that because at some point while I was in school, I studied with someone who was autistic. That I think was level 3. And at that point, everyone would, like, just in case they do something, wacha nikae mbali, you know, and I'm sure that made them feel some type of way. So as a community, we should do better in making them feel part of us, because they are. Umesema, if you make them feel special, they will be special, because you've made them feel, you know, that's just you and that's how you are. But it's good for us to understand them. Now, I have this question which has imespark kitu. Anasema, hello, I'm living with an autistic kid who is non-verbal. Think anataka kusema an autistic kid, but they don't speak, like it's for them it's fully non-verbal. Akisema where is that question? Yeah, who is non-verbal? So anauliza, how can I help them communicate effectively? So non-verbal, fully non-verbal, but sasa anauliza, how can they help this kid communicate effectively, even though we now truly know it's not through words, but how can they be helped to just communicate well?
Okay, that's a very good question. And that's a good observation from the parent. So one thing the parent can do is, your child cannot express themselves verbally, but they can understand what you're saying. So just ensure that you speak to your child clearly. Make sure whatever it is that you're telling them, tell it to them, and not just telling it to them, but tell them and show them, so that they can associate what you're telling them to what you're showing them. Yes, and you can also use other other means of communicating with your child. For instance, you can have pictures, you can have items so that your child can express themselves through that. If they want to eat, maybe they know that if I want to eat, I can show mom this, and mom will know that I need something. So a lot of visual aid in communication can include that. And you can also, I teach children who have hearing impairment, and therefore they also don't have the verbal aspect of it. So you can also learn sign language and teach your child sign language to bridge that. So if they want something, they can indicate with a sign, and it will be easy for them to communicate. Yeah, so those can really help to bridge that.
I see. So you've done sign language as well?
Yes.
You know, you were told when you meet someone who has learned sign language, usually, mostly, guilty as charged. Guilty as charged. We're also very quick to tell them to communicate something through signs. We will do that before we finish. You'll tell us, you'll say now it's using sign language. Labda nitakuja classes. Now, you'll be giving us your parting shot. But before that, what do you think schools should do to accommodate people with special needs as a whole, not only autistic, but people with special needs, to accommodate them and make them feel part of the school, part of the community? What are some of the inclusions that schools should add on to?
Okay, thank you. So, as part of being inclusive, an inclusive setting in a school, schools should first of all, as you said, with all cases of special needs, that is, whether it's visual impairment or hearing impairment. So first of all, the environment of the school. So look at the school environment. Is it accessible to everyone? Those with physical handicap, can they access every place of the school? The school should also not only have, the school should also be very expressive in the way they give the instructions. When you walk, can you read? Is there something written? Is there something drawn? Like if it's written, it has to be with a drawing to accommodate all this, because there's special children or special people who they are not strong in their visual, but their hearing is okay. Or they're strong in their hearing, but their visual. So engage all the sensory channels in your school. And also very important, all schools, I believe, should have a special needs educator to guide the school in case there is other intervention measures that are needed or any other thing. They can inform, and they can give a very informative, they can give information that is very helpful, in that instance.
I see. Now, what would be your parting shots?
Okay, my parting shot. Okay, let me say this. So, my parting shot is that as a society, we should strive to learn more about people, especially because we're talking about people with autism. We should strive more to learn about people with autism. We should educate ourselves also. So it's also on our part to learn about how they live, how they think, why do we think they're different. And because there's also so many resources out there, there is no excuse really. So just get to learn, get interested in any which way that you can, whether it's you enjoy educational videos like this one, or you'd like to interact one-on-one with those individuals, so you can do that, and that will be very helpful for all of us. Yes.
Perfect. So that has been it. Thank you so much for joining us on this program.
Thank you for having me.
We'll be giving the numbers. I see that we have people who are still asking for the numbers. We'll be giving the numbers in a very short while. But this is just to remind you that, as Doc has told us, and as you've repeated just now, that autism si uchawi. It's just a neurological problem that can be sorted. We've been told about how you're supposed to manage it. We've been told about how you're supposed to live with people who are autistic. If you know someone who's autistic, what are you supposed to do to make them feel more comfortable? Okay, so these are people who are very smart. These are people who are very normal. So it's for you to just allow them to live that normal life. Sawa sawa. But if you have any question, you feel like you need help, our numbers are very open, and I'll be giving the numbers once again. And You can call Dr. Daniel on 0727 052953. 0727 0529, exactly on your screens, 53. And you can call directly to the clinic, which is 011 46 07 so I repeat, 011 46 00796. Sawa sawa. You can always get help. There is help. There is help. Okay? So thank you so much for being with us. Thank you so much for sharing your experience and telling them what they're supposed to do, just to be able to, you know, accommodate people who are autistic, people with autism. I know that has really helped. Okay. Now, this is your chance to sign out using sign language and then explain what you've said. Please go ahead.
Okay, so instead of signing out, I would rather teach the basic courtesy words that you can use or that you can start using. And I think that is better if I do that.
That's better.
Yeah, so this is how you say hello. So when you meet someone with hearing impairment, or you can just incorporate it in your greetings. You can just meet someone and be like, hello. It's a nice one. Okay. Then you say thank you, thank you, or thank you. And then you say sorry. Yeah, you paste through your chest, sorry, and please.
Yes. So sorry, it's your fist.
Yeah, sorry.
And then please.
Please is with an open palm.
Okay.
Yes. So hello, thank you, sorry, and please, and welcome.
Yes. Okay. Works well. Assignments next week, mtatuambia kama mmeshika. That is very important. Thank you so much. This has been really nice. Thank you so much for tuning in as well. Now, we are just about to wind up, but hatujamaliza bado. But as we wind up, I'd love for us to take a look at Did You Know? So, Did You Know? Imeandaliwa na the one and only Martin and the amazing team. It's a huge team. So, Did you know? Inasema, did you know that rainbows are actually full circle, but we usually see only part of them? It's like half. Menakwanga 3/4 of it. Did you know that rainbows, they're a full circle, but we can only see a part of them? That's very interesting. Tulisema tukileta Did You Know, you go back and research. Did you know that? Did you guys know? Yeah, so that is it on today's Did You Know? Thank you so much for tuning in on Afya Clinic right here ndani ya MBCI TV, where we transform lives by the grace of God. We wouldn't have done this without you. This show was important because you asked us to talk about it. Yeah, so thank you so much for your time. Thank you for spending your time with us. We value you greatly. Thank you so much for being with us. And Dr. Daniel as well, asante sana in absentia right here, as you can see, but asante sana for tuning in. I know that through the discussion that we've had today, you have learned something and that may change perspective. Yeah, we've had so many people saying that, not so many, but a few people saying that, you know, autism is caused by this, by that, by witchcraft, by bad parenting. Now we know about all that. So go online, research more about autism. That will help you to relate with the autistic people even better. Okay, so asante sana. God bless you. Have an amazing rest of the day. My name is Rachel Kahugu. I'll see you on Wednesday, where we'll be having an amazing topic on Afya Clinic. You'll see me on Wednesday, but hapa katikati tutapatana hapa na pale. All right, but on Afya Clinic we'll meet on Wednesday, where we'll be having an amazing conversation, so do not miss out. Okay, and today we have an amazing outline for you. The programming is the best. Sawa, we say that MBCI TV is a family TV, so siende mbali, do not leave. This is the place to be. God bless you. God be with you. Enjoy the rest of your viewing. Bye bye.
Emmanuel, the only God who can stick to his own and bring things to pass concerning them.